Hello. Hello again, everyone. I'm Lisa Richter, Avivar Capital, an SEC registered investment advisor that focuses exclusively on what nowadays is called impact investing. And I realized, having walked up here, that I don't have my iPhone for a clock. I wonder, is anyone watch equipped? Because we are on a tight time frame and want to be sure, fantastic, that we can have plenty of time to hear our panelists as well as hear all of your questions. So I am delighted to be joined today by Maurice Jones, President and CEO of a Local Initiative Support Corporation, as well as Lisa Williams, Vice President of Goldman Sachs. And our charge is to explore why and how values are changing among business investors. And if you don't mind, I think we will just generalize that slightly to say why and how are values changing in what we call the capital markets, which is the system in which investors interact with those who need capital. Investors, the supply side of the market, those who have capital to invest, whether it's in a savings account at a bank or whether it's multi-millions of dollars with Goldman Sachs, investors who have money, and then supply side, and then the demand side, those who need financing, whether it's for a mortgage or to start a healthy food cart as a micro enterprise, or to finance a federally qualified health center, or to issue bonds for a health system, or to have an initial public offering of some kind of a growth business. So what we're seeing and what we want to talk about today is how values are shifting in the capital markets and how investors and those who use capital interact. And I'm just going to take a very few moments to frame that, and then we'll be fortunate that we have Maurice today representing a demand side, stellar, world-class institution that uses capital to invest in communities, and Lisa, of course, representing the supply side of investors that seek out Goldman Sachs advice and guidance to make their investment choices. So if we go back to when we can sort of pinpoint the beginning of this change in values in a very tangible way in the U.S., I'd call out 1968. That was the year in which the Ford Foundation invented what we call program-related investment, which is investment that is made primarily to advance a charitable purpose. And they did that because they saw that their grant making to organizations in low-income communities was not having a sufficient effect in terms of changing the conditions in those communities for residents and for organizations and for businesses. And they thought that if they could bring investment capital to the table and make loans to a community theater or make investments in businesses owned by people of color, they could allow those organizations to participate in the capital markets, which were really not working in low-income communities, be they the urban low-income communities that were typically inhabited by populations of color, or be they the rural communities that also suffered from a lack of capital. At the same time, I think it's really important to note that women religious, orders of nuns, typically with their retirement funds, which were scant, were also channeling those dollars both to grassroots lending efforts like Ford, as well as voting their shares to do things like argue for South African, the dismantling of apartheid. So we had significant efforts at the grassroots and also efforts within major corporations that caused folks to begin to think how dollars were flowing and what kind of effect that was having on communities. And I would just say since that time, which is now 50 years, the field of impact investing and broader socially responsible investing, which has now been renamed as sustainable and responsible impact investing, has evolved, has continued to broaden to additional sectors, initially from community development to environmental preservation, to asset building, to education, to bringing technical overlays to all these things, ed tech, fintech, health tech, et cetera. And really in about 2010, to look at how we could use these tools to drive better population health. And we'll talk much more about that in a moment. But the bottom line is, over that 50 years, we not only broadened the ways we could use capital to drive change, we also saw the professionalization of organizations like Maurice's, which today is much bigger than many community banks, and which has an SEP rating and has issued bonds in the capital markets. And we've also seen an emerging track record that these investments that were early on rejected as a granola fringe actually today are being mainstreamed. You should incorporate environmental and social criteria because that's prudent risk management. And in fact, it might even help you to achieve a better financial return. So that's a 50-year arc, and within that arc, we're going to take a moment to hear perspectives from Maurice and Lisa from the vantage points of their institutions. So Maurice, thank you for joining us today. I wonder if you could give us a little bit of a thumbnail history of Lisk that describes how it got going, what it was trying to do, and then maybe if you could highlight for us the moment or time, I know you weren't there, but you may have been seeing it from the outside, when Lisk became aware that the kinds of lending that it was carrying out were in fact addressing what was coming to be called social determinants of health.
Now? Oh, there it is. Okay. I'm not technologically all that adept.
Join the club.
Well, good morning. So Lisk has been around for about 40 years. And actually, Lisk was probably the recipient of the first program-related investment from Ford and MacArthur and team. And if you look at the arc of Lisk, where we in most of the community development finance field started was housing, right? It was how do you go into, at the time that Lisk started, abandoned neighborhoods around the country and work to bring back markets for the real estate assets in those communities. And so where Lisk started was where Lisk stands for Local Initiatives Support Corporation. We started as an organization that would provide access to capital to local neighborhood-based community development corporations, which were attempting to take abandoned real estate and bring it back to the market and catalyze a market for housing in those neighborhoods. And the thought was that housing would be the way to revitalize the neighborhoods. And that 40 years ago was where, frankly, the development finance field started. We went on from being a support corporation for community-based organizations who were attempting to rehab housing to a more general community revitalization or transformation organization, as we realized somewhere, frankly, in the 90s, that you could not turn around neighborhoods by just doing housing, and that there were other ways to spark imperfect markets, namely financing small businesses and entrepreneurs and financing schools and community facilities And so we transformed, as did the field, from completely housing-based to one where we were looking at various assets where the market was just imperfect and attempting to, frankly, and this is where I want to take it, be the first lender that would leverage other capital to these markets. And that's really the role that we play in these underinvested and disinvested communities, is as first capital in, taking the risk so that more traditional financial institutions will have us as the risk takers and come behind us and stack capital for these communities. And that's really the way it works, and the way it works well. We are seldom in a project by ourselves. We're usually the first capital in with other capital providers, philanthropic, traditional financial institutions coming with us, participating with us, coming behind us, usually us taking a first loss position. And that's the way that the markets have really, really worked and are working right now. And there's much more work to be done, but that's really the way that, that this works and works well. And you include in that government as well. You bring the government tools to the nonprofit tools and the traditional corporate tools, and you actually have a way to make investments in these communities, catalyze a market, create social return, and create financial return. It's working, and I want to tell you, we have invested $20 billion in disinvested communities in 40 years. We've leveraged $60 billion. Our delinquency ratio is below 2%. So you can do it prudently, you can produce results, and you can produce market returns, or I should say you can produce returns for folks who are interested in getting financial returns. Does that answer your question?
That's fantastic. That's a great start. And just in terms of thinking about how this conversation hopefully will lead to other conversations, part of what Maurice was describing is what in the jargon we sometimes call the capital stack. That Lisk is willing to bear more risk. He referred to a first loss tranche. He'll take the losses in a deal before a conventional lender, because if he gives them that so-called credit enhancement or risk mitigation, then they're willing to bring their much bigger dollars on board. And we need those big dollars to drive the scale of change that's needed. Maurice, I wonder if I could ask you, first of all, if you might think a little bit about how community development is different in rural versus urban communities. And I'm asking that because so often this conversation focuses on urban communities, where by far the majority of people live, of course, but particularly in today's environment, we understand the importance of rural communities and some of the issues that they're suffering.
Yeah, that's a great question. You know, I think I would say the material differences include, because there is a relative lack of density, it becomes harder to attract investors. So attracting investment capital to rural areas is tougher than attracting investment capital to Brooklyn. That's number one, and that's a sheer matter of head count. The second is for the work that we do to actually produce results, you need more than capital. You need local organizations who can really, really roll up their sleeves and get a project across the finish line. You need blood, sweat, and tears. You need what we call technical capacity. And the bottom line is that you have less capacity amongst neighborhood-based groups in most of rural America vis-a-vis urban America, metropolitan America. And so that infrastructure that you need is just less present there. And then frankly, the incentives to bring in the other capital are not as powerful in rural America as they are in urban America. So let me give you an example. The Community Reinvestment Act is probably the most powerful, and I won't get too technical, but it is a federal requirement for banks to provide capital, frankly, in places where they used to redline. Well, it's all based on right now, where banks have physical outlets, where they have branches. Well, guess what? In Cambridge, Virginia, Bank of America does not have a branch. And so there are few incentives as well to help us attract that capital. And the last thing I would say is government usually is a partner for us in most of our investments, and the government capacity to do sophisticated transactions of a financial type are in general, and I won't say this because I'm speaking in generalities, I know I'm inaccurate, but in general are weaker in the rural areas right now than they are in the metropolitan areas. So those are some of the reasons why it's tougher to do this work in rural areas versus urban areas, but I want to end with it is done, it can be done, and it is being done. So just because it's tougher does not mean it's impossible.
And Lisk is one of the organizations that forever has had a commitment to providing community development finance in rural as well as urban communities.
So we work in 2,000 rural counties in 44 states.
Mm-hmm.
So, and again, that's all baked into that less than 2% delinquency rate that I mentioned earlier.
And remind us once more, Maurice, what is the assets under management at Lisk currently?
So we have right now a $450 million loan portfolio outstanding.
Okay, great. So that's spread in urban and rural communities. And, I think we implied it, but perhaps we did not spell out that Lisk is an example of a community development financial institution, or CDFI, which is a niche financial institution that has a primary mission of community development in an underserved area or with an underserved population, and they work nationally. But the other situation I think that can be challenging for many urban as well as rural communities is that they don't have a locally based CDFI. And that's why it becomes so incredibly helpful that we have some significant regional and national partners like Lisk who are willing to go and partner in areas around the country. That's super helpful. I do want to go back to the evolution that happened in the field in the 2010s or so, when we in the community development field started getting invitations from the Federal Reserve Bank of San Francisco and elsewhere to come talk about why the fields of health and community development should basically get married. And it was because of the data set cited earlier today where we came to understand, this is really captured so beautifully in the county health rankings that David Kindig helped to lead, that at least 70% of health outcomes for population health really come from community factors, be it the built environment, socioeconomic factors, or access to and quality of care. If we don't build communities where people can make healthy choices, the other 30%, we can't expect to realize that vision of population health. I suspect, Maurice, that Lisk, like many CDFIs, was really thrilled to get this new sense of relevance of their work. I'm just wondering then, how did it affect the internal thinking about measuring impact or other elements of the strategy?
Yep. So a little over a year ago, Lisk announced that we were going to invest $10 billion in the next 10 years in communities that are underinvested and disinvested all across the country with an intentional focus on moving health metrics. And that we wanted to do this with healthcare partners in particular. That for the first 40 years of our existence, the financial institutions have been our anchor institution, private sector partner, but we believe that from a standpoint of values and mission, that we have a stronger alignment with healthcare, and we wanted to put our money where our mouths are and invite healthcare to be partners in this work. And I'm delighted to say that, and so we have hired a healthcare team. We have aggressively pursued hospitals as partners, and within months of announcing that $10 billion commitment, we had a hospital in Toledo, Ohio, to step up and say, you know what, we want to jointly collaborate with you on a social determinants of health fund for Toledo. And ProMedica was the hospital, came forward. We created a $45 million social determinants of health fund. And with that, they wanted to focus on a particular area in Toledo called Uptown Toledo, those of you who know it. And we're doing housing work there, and we're doing economic development, which is commercial corridor building, workforce development for individuals, and investing in small businesses. And where this first came was when ProMedica was surveying the patients coming through its emergency room, and they kept getting back responses that the biggest challenges that these patients were facing were food insecurity, or asthma was disproportionately coming through their doors from a particular neighborhood, and they wanted to do something about it, and the only way they could do it was to help residents make their homes healthier. And so they found us as a partner who could do this work in the neighborhood, who had been there for 30 years, had relationships with community partners, and that we could jointly get together and do this. And not only were we going to measure, housing units that we made healthier and jobs that we were producing, but they were going to measure readmission rates from a particular area and other impact factors that they thought were important on the hospital's operations. We committed to a 7 to 10 year journey, and we're going on that journey with them now. And we're having other hospitals who are stepping up and wanting to do the same thing with us, and it's exciting for us, and it's the kind of partnership that we need. The hospitals have, frankly, better data on the residents from the neighborhoods that we're trying to impact than we do. They're seeing them as patients. We have the ability to actually get the work done, and we have, frankly, better relationships with community-based partners than the hospital has. And so it's been a great partnership, and one that we are now replicating or trying to replicate all over the country. I wish there were a more efficient way of doing it than the way we're doing it now, but it's really about building relationships, building trust, making sure we understand what the hospital's aspirations are and what our aspirations are. But look, what we noticed was what hospitals were noticing. The census tracts that we work in versus the more affluent census tracts in the places where we work have sometimes 10, 20, and in Boston, 30 years difference in life expectancy. The hospitals were seeing this. They wanted to do something about it. For us, it was a prime value. The marriage was relatively speaking, easy. The question now is how we, and I don't want to take this metaphor too far, it'll get me in trouble, but we're looking for multiple marriages.
It's called scaling.
Yeah, we're scaling. That's it. And a lot of it is making sure that the medical field understands what we do and that we understand what they need in order to be successful, and working together to forge a partnership. But it's the most exciting work we're doing right now.
It's phenomenal. And I think we couldn't have a better example of the demand side of the capital markets, where Maurice needs to raise capital in order to deploy it into housing renovation or commercial corridor renovation or small businesses, et cetera. And it's for that reason that I would like to put on record in today's proceedings that access to capital is itself a health determinant. We sometimes say that the capital markets or the markets are the invisible hand, and the flow of capital tends to be something that we don't think about because it's invisible, and yet the effects are powerful, and the potential to amplify those effects through scaling the kinds of partnerships you're talking about is very significant.